Hi students, I thought I would take a few minutes from my professional development this week to review with you the recent quiz that we took on Friday. I've decided to use this as a practice quiz. There were a couple of challenges with responses, and for those who took the manual quiz at the park, there were a handful of you who missed the back side of page 1, so we're just going to count this as a practice quiz. So I'm going to review it, and this is an invitation for all of us to pay attention closely to questions at what's being asked and make sure that you understand clearly what's being asked before you respond. Okay, question number 1. Medical records are required to be stored for how long following the discharge of a resident? The correct answer is 7 years. Number 2, the medical records coordinator should be hired with credentials from which organization? Correct answer is A, the American Health Information Management Association. Number 3, infection control. Healthcare employees must protect themselves from the rapid spread of COVID-19 and other viruses and bacterial agencies. What is the most appropriate hand washing technique for this cause? Name the 3 best practices that should be implemented. Most of you selected only one answer. Few of you selected 3. And that's what the question asked, was to name the 3 best practices. So the correct answer is A, if possible, use disposable towels to turn off the tap and open the bathroom door. B, if a disposable towel is not available, air dry your hands using a powered hand dryer. And then D, dry hands using a clean disposable towel if available and rub vigorously until they are dry. Number 4, dietary, which is not a paid position in the dietary department. The correct answer is B, the dietitian. Remember, our dietitians are contract employees and they are not on the schedule or they're not on payroll. Okay, moving on. Number 5, in nursing, which employee bears the overall nursing staffing department and the skills of the employees? This is a repeat question. The correct answer is A, the DON. Number 6, physician services, treating patients in the facility. Which entity does the physician bill for his or her medical care provided? The correct answer is B, third-party payer. We will discuss more about the services of the physician in our upcoming classes in resident care management. Number 7, the activities department. The activity director must be directed by a qualified professional who is eligible for an occupational therapist, therapeutic recreation assistant, or an activities professional by a recognized accrediting body such as the National Council on Therapeutic Recreation Certification. That answer is false. Make sure that you read the question carefully. I asked who is eligible for an occupational therapist, and so the regulations do not state OT. It starts with therapeutic recreation assistant. So that's just an invitation for you to pay really close attention to the questions as they're being asked. The next question, dietary. What is the regulation for the dietary consultant hours for a facility with 60 residents or less? The correct answer is C, 8 hours of consultation for a facility with 60 residents or less. Next question, in dietary, there must not be more than 12 hours between a substantial evening meal and breakfast the following day. That question is false. There should not be more than 14 hours, not 12. So make sure that you are paying close attention to the hours and the numbers on any question being asked. Right, additional dietary questions. Which one is not a requirement for food service employees? The correct answer is 4. Employees do not have to wear uniforms that are dry cleaned. They must, however, be in good health with no communicable diseases or open wounds. They must wear a hairnet and they must have clean hands and fingernails. I just wanted to highlight that for you. Number 10, nursing and infection control. Asepsis is the presence of harmful microorganisms. Several of you got that one wrong. It is false. Asepsis is not the presence of harmful microorganisms. It is the absence of. The next question, nursing and infection control. Nosocomial infections are in-house acquired infections. That is true. Make sure you remember nosocomial infections. Those are infections that a resident and a patient acquire while they're being treated and cared for in a healthcare setting. Number 12, housekeeping. What is the regulatory requirement for room cleanliness? The correct answer is C. They are to clean rooms daily. Number 13, nursing and infection control. As nurses provide care and treatment for 2 patients in the same room, is it okay for the nurse to wear the same pair of gloves? No, it is not. The correct answer is false. He or she, treating residents and patients in the same room. They must change gloves and also wash in between removal of and putting on new gloves.